it is a whole system of medicine. So you have to know about each and every diseases, and what are the limitations of homeopathy also. You cannot diagnose, you cannot cure, you cannot give any medication, but in holistic practice you can suggest some medicines, you can teach some homeopathic ways, like how to heal ourselves. One of the case is hirsutism. So hirsutism means excessive facial growth in women. That I got good results with homeopathic remedy. It's called calcarea carb. Autoimmune conditions, it's hard to treat. Even some skin conditions, psoriasis especially, then stomach ulcers or anxiety, anxiousness, anxiety, mind complaints. So that type of cases are unusual. It is not just science, it is art. Homeopathy means like your likes. So substance which causes symptoms in healthy human being can be used to heal or cure. We have to take proper case, and we have good information about that person, then only we can match the remedial picture to the patient's picture symptomatology. Then only we can get a good results. To find out remedy, it is a tricky. For one fever complaint there are like a 200 to 300 medicines. For each complaint there are a lot of remedies, so we need to shortlist. That might be a tricky part in homeopathy. Some patients, they have a lot of emotional issues, mind problems, and at that time usually we also get some headache also at that time. That is mainly useful for some mind complaints, some concentration complaints, and it is helping because I'm using some like our Indian raga also for that. The wellness is very important nowadays in US and all over the world, because it helps to prevent the chronic conditions like diabetes hai, or any BP or any other like chronic condition cases. We can we means in we can prevent that.
Welcome to What's Up Pro. Today we have a special guest, a homeopathy doctor and a holistic practitioner who integrates natural remedies and holistic approaches to promote health and wellness. It's fascinating to know how she uses percussion to heal her patients. Please welcome Dr. Vaishali Bhide. Welcome Vaishali to What's Up Pro.
Hi.
Hi. So how's life? What's going on?
Yeah, busy. Yeah.
Yeah.
And thank you, Gayatri, for giving me opportunity, and mainly good luck and good wishes. Congratulations for your new venture. Yeah.
Thank you. We know.
Nice initiative.
Thank you.
Mhm.
Something, yeah. So we know you are a homeopathic doctor, like a homeopathic practitioner. Can you take us through your journey? Like, how did you start? What motivated you? How did you
Yeah.
get into
Okay,
this?
okay. Yes, sure. Yeah, it's a long journey and difficult also. Setting up practice is not a joke, and it's hard for everybody, for every clinical, doctor, it is hard. So this is chart started like maybe 25 to 30 years back. So I did my graduation in Pune, back home in India. And it was like a 5.5 years total course. So the homeopathy is a whole system of medicine. So that's why it is a full course. It includes everything like anatomy, physiology, homeopathic pharmacy. Obviously, the basic surgery means you have to know about basic surgery also. So OBGYN. So because it is a whole system of medicine, so you have to know about each and every diseases, and what are the limitations of homeopathy also. So if there are like a surgical cases, then you have to be aware, like these are the typical surgical cases. You can't do much in that. You can you can do like a supplementary thing, but surgical cases are surgical. So that's why like it's a full course. And another thing is, I mean, in India, it's like a full-time course, 5.5 years, equal to conventional medicine, like MBBS. And outside of India, there are like, it's not typical homeopathic course. I don't know about a lot of countries, but most of the countries they have, means they can practice. Like if there is a MD, like medical doctor, they can practice homeopathy, but obviously they should have interest and a certification also. Another thing is ND. ND means naturopathic doctor. In US also they have some naturopathic doctor universities, and all those things. So they can practice homeopathy. Uh, Other ways, like a holistic practitioner, means you are not any medical person. Means you have to be, means you should tell your patient, like you should be connected with your doctor, like a medical doctor, and you are just giving like a supplementary to main course of medicine. Okay, so you cannot diagnose, you cannot cure, you cannot give any medication, but in holistic practice you can suggest some medicines, you can teach some homeopathic ways, like how to heal ourselves. So that way you can do. And yeah, so main, I think these are the three ways to do homeopathy. And it's like a full-time course, so that's why like we have to be aware of giving medicines, what are like what which cases are in our limitations and what are not. So that is the main thing. I started like clinical practice like 25 years back, and obviously, like everybody knows, it's very challenging. So I took like a chance of with the homeopathic pharmacy. Means I was in the homeopathic pharmacy, and then from there I started my clinical thing. So the pharmacy helped me to get more clients, patients. So that's why. And even even I was practicing at that time, I got like a very good results with some few challenging cases. Like I would say one of the case is hirsutism. So hirsutism means excessive facial growth in women, and maybe due to some hormonal imbalance or whatever are the cause. So for that, I got good results with homeopathic remedy. It's called calcarea carb. Means that hair length was like a 2 inches, and with the calcarea carb, it reduced to zero point 0.5 centimeter. So it was so, like this unusual cases especially built up our confidence. So this type of cases, unusual cases like this hirsutism, then autoimmune conditions, it's hard to treat. Even some skin conditions, psoriasis especially, then stomach ulcers or anxiety, anxiousness, anxiety, mind complaints. So that type of cases are unusual, but unusual are like normal, like cough, cold, general jaise aata hai वैसे.
Right.
Some fever,
Right.
some stomach upset. So those are like a normal cases. So mm, so you still means I'm learning. So that's why it's called like a medical practice. It's a practice every day. It's a practice. So that way I started.
What motivated you to get into like homeopathy?
Like there was not such a motivation thing, but I like the way or speciality of that homeopathy. Means I would say the homeo is like a similar, and the way is a pathy. So it like cures like. So this thing was very different than usual pathies. So this is the main specialty of homeopathy, or maybe this thing, it motivated me. And it is not just science, it is art. So it is art and science, to case taking का जैसे है. So mainly for case taking, it is art and science both. So that is the main thing I loved about homeopathy. So
So when you say it is an art and science, what is art part in this? Like the
art means
science
is
part, like,
mainly counseling, but not counseling exactly. You need to take whatever is the deeper inside the patient. That is the art.
okay.
So mainly how to bring that inner side problem to outer side. That is the main thing. So that is the art of homeopathy. And mainly another thing, it is a matching homeopathic remedies also to the patient. Means that is the thing I'm saying right now. Like homeopathy means like your likes. So substance which causes symptoms in healthy human being can be used to heal or cure. Means that substance, when we use in the sick people, it is very 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 small amount. So that thing, it's called potentization. So when we take, like suppose if there is onion, so onion you can take, and the basic extract of that is a mother tincture. So that mother tincture we take, then 1 drop of mother tincture and dilution with the 9 drop of water or any other liquid, and then we shake it. So again 1 drop of that, again dilution with some liquid. So 1 2 3 4 30 times, 200 times we dilute that remedy. So this is the exactly opposite
Yeah,
way of thinking,
yeah. Like
to
very
like a
kind of
pharmacy. So yeah, it's a different mode of
art.
um, preparation. So that is the potentization we called. So more dilution, so quantity of the substance is reducing and the power is increasing. So perfect ulta hai jo hai wo. So
Yeah. Because that the
so
tablets are like very tiny. Everybody
yeah,
likes to take them.
yeah,
Those-
that pills are like a saclac. It's a basic mediator. It's
Mm.
not exact medicine. Medicine are like in liquid form. So law every medicine is in liquid form. We put that liquid on the top of pills. So pill is that is a carrier. It's just carrier. Easy to carry. Yeah, that's the thing. So we can give it in pills or in water. So
Yeah.
but easy to carry than water. So that's why those are like a sabudana pills.
Sabudana pills. Those are
I
favorite
know.
ones.
Favorite for kids especially.
Okay, yeah. That's the only medicine they take it happily.
Yeah,
Yeah.
yeah.
So, tell us about your typical day at work. Like, how do you
Typical day,
take,
yeah. So
find patients, new patients, or
yeah. So typical day for new patients, it's challenging again because it's like again art and science to find out what is happening to that person. So we take case mostly like 30 to 40 minutes, and we need to dig out a lot of things from inside. And obviously the physical complaints, mainly aggravation, amelioration. So these are like a particular symptoms. Means for some people, like you might like in the sun, but I don't. So this type of differentiation we call is like a individualization. So each and every person has their own individual expression of the complaints or personality type. So we take that each and every thing, while especially for the chronic cases. Acute cases, there is no time. You have to be quick. So so that is the way. Follow up is easy than acute, sorry, chronic. So that way, but it's still tricky. Means I can tell one case, like that case was for bedwetting. I was giving some medicine, but it was not working. And then I asked her to bring him in. So we talked about his personality type. And then his small kid, like 4 5 years, so he was talking about his expressions about friends and girlfriends, not girlfriends, but still. So according to that, I could choose the remedy which is closer to his symptomatology. So I changed that previous medicine and I then gave like a new one, and it worked miraculously. So bedwetting stopped now. So
So
that
it
is the,
varies person to person. Like one
yeah,
medicine
person.
cannot give for one problem. It is.
Yeah, person to person it differs. So every day challenging, but interesting also.
Yeah,
Yeah.
you
So
meet so many people, so many types of people around you.
variety.
But yeah. Can you tell us more of your like success stories? How do you like effectiveness of homeopathy? You gave us two examples, but any more?
Yeah, I gave two examples. Yeah, it's mainly the success is depend upon matching remedies. Means that is the philosophy, right? Similia similibus, like your like. So we have to be we have to take proper case, and we have good information about that person, then only we can match the remedial picture to the patient's picture symptomatology. Then only we can get a good results. Otherwise, like maybe we get like a partial effect. So then again we have to find the complementary medicine and all those things. So that is the little bit tricky part. For some patients, they don't have much symptoms to tell, or difficult to match the remedy to symptoms of the patient. Then it's little bit tricky. So yeah, there are certain, or obviously, like if there is like a irreversible pathology is there, then it's hard to give some any medicines like homeopathic medicines. If it is a reversible pathology, like inflammation hai kuch ya aise kuch, then we can do something, but not for irreversible pathological changes. So
So you have any set questionnaire when you get to.
yes, yes. We have like a 2 3 pages questionnaire, but still it depend upon patient to patient. Means sometimes patient, if if patient is extrovert, then she will or he will tell everything. If it is introvert, then we have to find out, or we need to ask some questions. So that way, yeah.
So why do you think this is not very common as compared to other uh, treatments people take?
Nowadays in uh, I think South Asian, it is very common now. Like homeopathy is very common. Like long time back when I was studying, or before that, maybe it was not common. But nowadays it's very common
And
in
very
Asian countries, yeah, and in some part of Europe, in some part of US, even some part of South America. Nowadays in Brazil, it is growing. So one more thing is, it is to find out remedy. It is a tricky. Means
Mhm.
for one complaint, means for one fever complaint, there are like a 200 to 300 medicines. So we have to get that symptomatology to match the remedy. If it is not, then it will not work. So it is not sure shot remedy for each complaint. So for each complaint, there are a lot of remedies. So we need to shortlist that remedies, and then we have to give. So that might be a tricky part in homeopathy. Homeopathy is good, actually. Means pathy is nice, but homeopath should be wise enough to find out remedy.
So you have like different kinds of clients, like South Asians, Americans.
Yes, yes, yes. I
So,
have
but
like a mainly Asian, mainly South Asian, especially from like Indian, then all other countries, like our nearby countries. Then in US, most of the people are like European origin. They come. Some are from like Belgium. Some are from Greece.
Mm.
and some are from like South America, mainly Brazil.
Right.
So yeah.
So their different culture that also affects like cultural difference.
Yes, cultural, mainly, it is invented in Germany. The homeopathy is invented in Germany in 1700, but it is more popular in Asia. So, don't know, but yeah, so
So
most of the people
they-
they like homeopathy nowadays in US also. The main like 70 to 80 remedies they are keeping in Whole Foods and what is that another one, Wegmans.
oh,
So in yeah, that type of pharmacy they are keeping it. Almost 70 to 80 remedies are there, so
oh, okay. That's interesting.
yeah.
So their culture, their eating habits, everything must like you
Yeah,
should.
means that is also a point because I have like some patients from like African patients, and they are having means their eating habits are I don't know, like for the especially for the kids, they are obese and lot of fat thing. Their LDL all levels are jumping up. So don't know the actual cause, but maybe the eating habits are bad. So that's why the cases are there. Mainly, what do you say that ADHD also. So
Mhm.
ADHD also the main thing, maybe causative factor is the eating habits. So mainly of parents also and kids also. So
Right. Right. So all the people that you meet every day, they come with some sort of problems to you. How do you keep your emotional well-being?
I know. It's
It's all
sometimes it's
very,
really, yeah,
right.
sometimes it's really hard, means some patients they have a lot of emotional issues, mind problems, and at that time usually we also get some headache also at that time. Even they're very overwhelming, and sometimes their past like experiences, like horrible experiences are they faced, and they usually they tell us, and at that time also it's difficult to listen that, and so it is really disturbing
Mm.
while taking, or taking some case taking, like with that type of patient. So
Right. So how do
so
you
it
keep
disturbs.
your calm? Like, do you do some meditation?
Yeah, I do musical spa.
Oh yeah, that's that's another that was my next question. Like I
Yeah,
read on your website that you started music spa. So tell us.
yeah, a music spa is it's a basic, means music is an inbuilt quality of human being. So, and it helps to balance our mood. It can change our mood also. It can balance our mood, and mainly, um, that is mainly useful for some mind complaints, some concentration complaints, and it is helping because I'm using some um, like our Indian raga also for that. It's not like a music because um, if song also it's good, not a bad thing, but sometimes in song there are already emotions are there, so I don't want to mix up the patient's emotion and song emotion.
Right.
So
And the language.
according to so according to patient we need to choose like what thing or which, not exactly song but raga or any tune,
Mm.
not just vocal, any instrumental also usually it helps because it doesn't have that what is that emotion, means it is not disturbing or mixing emotion with that patient. So that's why means we need emotion or that bhava, but don't want to disturb the thing. So mainly it's like a vibration, so giving good vibrations to patient, and it is helping. So nowadays it is well known, therapy is going on.
Music therapy.
and it is helping for a lot of some autoimmune conditions, mind conditions, anxiety, even for kids, for focusing, some ADHD people. Uh,
So you do therapeutic drums, right? Like you use rhythm.
yeah. Yeah, I like that more.
Yeah, like
Yeah, because I like rhythm. I play tabla, but basic level, but I like rhythm. So, in while doing that also, usually anything whichever is the instrument we play, at that time our mind goes like, um, uh, with the no emotions thing, means it's a nil during, while we do the all this, focusing on any playing some instruments. So that is like a meditation level we are doing. So music is a main source. With that we can reach to meditation levels. So that's why. So, and even it is useful to cheer up the mood, because again it's giving the good vibrations to that person.
Mhm.
So cheering up, especially cheering in rhythm, the main quality of rhythm is cheering up, which we called in Sanskrit or Hindi, it's like a chaitanya. So that is the important thing.
Right, right. So you use this to treat anxiety, depression.
Yes, yes, anxiety. um Again, it has like some limitation. Severe type of, say, depression we cannot. Severe type of anxiety we cannot. Then at that time patient has to has with connected with their medical doctor. So each thing has limitation again. So
Yes. Yeah, this is very interesting when I read about
uh, me too.
that was very um so what is the highest level that one can achieve in your career field, like in homeopathy?
Okay. Mainly Asia, in India, you can do as much as like a MD,
Mhm.
like a uh, MD in homeopathy. MD in homeopathy. It's not MD in MBBS MD. That is the different thing. But this is BHMS MD. You can do. Out of India, I don't know exactly about higher level, but you can attend some good institutions. Like, in Greece, there is a doctor like Vithal Kos. He's not, I think, medical doctor, but he has a good experience. And like Vithal Kos is a good institution. In US also, there are some homeopathic associations. Um, so you can achieve that certification also. So that is the number one. CCH is good. And I think North American Homeopathic Association is there. CCH is there. So these are like good. These are like a good and well-known certificate, giving certification for homeopathy. It is a certification, but still it is a well-known.
Mhm, mhm. Nice. So are there any like associates, like support groups or anything for
Yeah,
networking?
yeah.
You're
There
all
are lot of groups, obviously, on Facebook, Instagram. In India, there is one thing is in National Institute of Homeopathy. Then in US also same thing, National Center for Homeopathy. It is in main office in Virginia, but they usually do a lot of like interactive programs and conferences, seminars, and all those are they can do all over US, especially in Canada also, maybe I don't know exactly, but still the National Center of Homeopathy is a well-known association in US. In India there are lot of, because in India it is a nowadays like a well-known pathy. So
that's nice. Good to know.
yeah.
What are the like complementary fields that you can like
Yeah, good question, because nowadays,
we need?
main is, yeah, it is lot of things are going on. Main thing is, along with this, is a wellness counselor. Actually, I did my certification from Cornell University for the wellness counseling. and it helped me a lot, means to get deeper into the client patient, and how to give counseling and all those things. So that is a well-known course from, Ivy League universities, from Cornell. Some they have from Harvard also. Like, it's certification course. It's not a like graduate or undergrad courses, but these are a good, even stress management courses from Harvard, and those are wonderful. I mean, in US is a well-known some certifications. Um, so this is about wellness counseling. The wellness counseling is again total, like mind, body, spirit, fitness, exercise. So mainly wellness counseling, it is useful for, I would say, like, to prevent the chronic conditions. So the wellness is very important nowadays in US and all over the world, because it helps to prevent the chronic conditions like diabetes hai, or any BP or any other like chronic condition cases. We can we means in we can prevent that with the help of, means mainly wellness is aware. A wellness counselor should aware some problems with the clients, and they should tell like what is it's good and bad. So that way they can, means client can change their lifestyle, their eating habits, their mindset, everything. So, and there are a lot of, another one is, I think, pranic healing and Reiki. I think both are like energy medicine, energy therapies, not medicine. But those are also good. Reiki is also well known all over the world. Reiki is good. Pranic healing is the similar type. I don't know exactly about those things, but I can tell the names, and whoever can interested in that, they can search more in that. Another is mantra healing also. So that is also interesting therapy. Another is a similar thing like music, rhythm. Another is a dance, dance therapy. Dance therapy is also useful for elderly patients, also for young kids, also, and for ourselves, also for fitness. For our age. But yeah, but dance therapy is also now growing up. That is also good. Um, one more thing I am forgetting, that Swara Gyan, I think. Swara Gyan. Again, I don't know exactly, but I think it has something with the breathing. So breathing techniques are there. That is a different thing. But Swara Gyan, it's Swara Gyan. Name is Swara, but it is not related to music, but it is some breathing techniques. So that is also nowadays, you can hear that Swara Gyan on YouTube also. So yeah, these are a lot of therapies, I would say. Yeah,
So
along with yoga is our main, but still.
yoga is also very vast, and I'm
Yeah,
sure.
masters. It is number one. Yeah.
So, how has this profession developed you as a person? Like, if you're not a homeopathy practitioner, or uh, you are somebody else, like,
Yeah, yeah. So
how has
mainly in homeopathy, we consider, for especially for chronic cases, we consider mindset. And while learning mind of others, you can learn yours also. So that is the important thing. So still I'm learning. So I'm improving my mindset, and it is helping me to improve my empathy. Then what do you say? Um, Patience. Obviously, patience teaches us patience. So patience, empathy, then compassionate thing. So that is helping me to improve my personality also. So
yeah, that's so many
yeah,
day that you have more variety of.
yeah, yeah.
So what are your hobbies? Do you get any chance, any time to
Uh, my
pursue?
hobby is mainly music, but not vocal, but rhythm, percussion, especially percussion. Um, uh, I did not do much, means, but I don't know. Maybe time wise, I couldn't do or something like that, but still I'm searching for that, and doing something in the rhythm. So like drum therapy, so I'm getting my hobby into, sorry again, getting my hobby into my career. So
But that's profession now. So anything else that
yeah, right.
you see as a hobby, like
uh Hobby means traveling, especially traveling, but not like hectic travel. Not trekking and everything, but just light travel. Yeah.
that
Travel mainly talking to people. I have like a lot of friends, and so friends, family. So I like people. So that
yeah,
way.
you
Yeah,
can talk to your patients so patiently.
yeah, right. I
Yeah.
know. First thing the patients usually say, like, "You are very friendly." Yes. So that I like mainly.
So
So
that's part of your personality that is.
right, right,
Mm.
right.
Any advice for aspiring
Um,
state practitioners, whoever wants to?
yes, yes. Mainly, first thing, you have to have, basic knowledge of your whatever you are doing. So mean health. If you are doing any related to health, then you have to have your basic knowledge about your career. And the another thing, you have to know what are the limitation, what you can do and what you cannot. So these two suggestions I wanted to give, like for especially holistic practitioner or like anybody. So these two things. So these are very important.
So is there any difference? Like I know like most of the doctors who study in who studied in India, when they come here, they have to, study everything again. Is it the same for homeopathy?
Yes, same thing. Same thing happened to me. I took some certifications, some licensing, and then I started my, practice as a holistic practitioner. So I'm not any medical doctor in US, but yeah, means I can practice or I can suggest some remedies to a client. So, but
And
yeah, you have to take some certification.
is it state-wise in US or
It depends, yeah. State wise, it differs, means all 50 states is different thing. So you have to check, you have to Google it for each and every state is a different, and there are really different licensing rules and regulations. So for some states, I don't remember, some 3 or 4 states, they need licensing, like proper licensing. Some states, they don't. So, but certification is good. So we should have some certification, and then only you can do something in homeopathy. Yeah.
do you do any mentoring for new students, like any internships or something like
Yeah, sometimes I do, but again, in US especially, there is a privacy. So don't want to interfere with the patient. So but for some patients, if they are open to, for new student, I can do that, but not for everybody. Yeah.
consent they have to?
Yeah, yeah.
Yeah, it's very interesting. I know it's very wide field, like home.
Yes.
Yeah, yeah. Because you were saying you're ENT doctor, you're surgeon, you're OBGYN, you are like
Yeah, yeah, everything. Yeah, from head to toe, it's a whole body system. So
mind also, like everything. So
mind also, mind in between, mind, heart.
thank you so
Mm.
much for giving us your valuable time and giving us so much information about homeopathy. I'm sure there are many students who would like to
Yes,
learn
yes.
and take it as their career. Like,
Right, right. Sure, sure. Good luck for them, and good luck for you.
that
Okay, okay. Thank you, Gayatri. Bye. Take care.